Hi, it's Dr. Casoni. Today we're going to talk about the treatment tree. The treatment tree is a simple concept. It just helps patients understand at what level the treatment strategy is aimed. So here we have our tree. Here's our treatment tree. So for example, branch treatment is going to be aimed at symptoms. This would be like taking a pill for the headache, an ibuprofen or something for the headache. It's not a good or bad thing, it just is not treating the cause of the headache, and it can be highly effective. Maybe if you don't get headaches very often, maybe all you need is branch treatment. Of course, if it's a chronic reoccurring headache, then we're not going to need to go more towards the root cause, right? Long-term use of even the ibuprofen can be a problem on the gut and on the liver, and whatever's causing the headache could also start to affect other systems. So if it's a chronic condition, then we want to go deeper and treat the root cause. Of course, you also can do both. You can get some immediate relief while you're looking at the underlying root cause. That's fine. When we talk about root cause treatments, we're taking into consideration causative factors, right? What is the pathomechanism, right? How did we get the pathology? What's going on inside of the systems? Because we know that if everything's functioning the way it was designed, then we wouldn't have this symptom. A root cause treatment is going to be based on those underlying causes. If you go to your doctor and they test your thyroid number and then they go to thyroid drug to treat the number, that is a chronic condition and a failure to even look at causative factors, and then a treatment that has no exit plan. That is a short-sighted style of medicine. Any particular patient might need or not need a thyroid medication, but there should be an investigation of other parts of the body that affect the thyroid and may even include some basic deficiencies like iodine deficiency that could be causing the thyroid disruption instead of getting on a medication that you're going to take for life. Remember, once you take an outside hormone, in this case, the thyroid medicine is a thyroid hormone, it will create negative feedback, making your own thyroid perform even worse than it was, and it builds a dependency. Like I said, that might be needed. First, with chronic conditions, we need to investigate the root cause. If we break down the treatment tree a little bit more carefully, we will go from the symptoms, which could be branch treatment, to maybe a little bit deeper, which I'm talking about function of the body, the systems approach. That's where the majority of our clinical work is focused. What system is in trouble? What's in the way of function, and then the treatment strategies that are aimed at improving function for that system. It's a completely missing line of thinking in conventional care. They're not looking at causative factors, and they're not doing treatment strategies to improve the function of the body itself. Now, if we go a little bit deeper, we will see the emotional state. The way we stress, of course, is going to affect the sympathetic nerve system, the autonomic nerve system. Eventually the cortisol levels go up, which lower the immune system, which affects the rest of the hormone system, blood sugar imbalances. This may be an important factor to consider with a lot of us. If we have a chronic condition, is there some driving factor coming from the way we're stressing? Could even be internal biological stress. So you're not emotionally stressed, but your body's having blood sugar swings that are generating stress hormones like cortisol. So it still affects the body with a level of stress. There are elements of our lives that we may not be able to change, and so we have to work around that. But it's worth noting if there is a significant amount of stress, or home life stress, or work stress, or biological stress, it's worth understanding that it plays a role. It may be causative, or it may just be exacerbating, meaning that the cause is something else, but the stress is making the condition worse than it has to be. That's exacerbating. Finally, we get to the deepest part of the treatment tree. The deepest roots are really what we might call spiritual. Spiritual is how to manage our mindset, right? So if we have a faith or a religious walk, That could be useful. If somebody has a spiritual walk, that could be useful. But we're basically talking about simple concepts that help us let go. What are we letting go of? We're letting go of the way that reality affects us. We can't let go of reality, right? That's called a hippie. We still have to show up and deal with the problems of life that life presents. But the suffering, the fear, the insecurity, the resentment, the frustration, and the self-criticism, those are the themes in which we suffer, and that's what we let go of. However you do it, however your practice, whether it's a personal one or a religious one, the goal in this level should be letting go of how the upsets of life are taking your power, how they're affecting you, leading towards a demoralized state, which compounds our physiology. It compounds any of the problems we're having. It becomes an exacerbation of that emotional state, which then exacerbates the challenges to the physical body and can end up with worsening or prolonging of the symptoms at the top of the tree. I'm drinking some tea. It's really good. This concept becomes important for a few reasons. One is that people come to me and my team and they have reached a point where either their life situation and their mindset is compounding with physical signs and symptoms to where it's a big mess, and they've reached a point where they need to learn to let go while we're treating them, or they've reached a point where their physical condition is the starting point. They don't feel well, and it's gotten bad enough to where it's changing their mindset. It's now demoralizing them. Either way, we end up in the same place, which is a spiritually sick state of mind. And the treatment has to be focused on the chief complaint and the physical nature of it, the causative factors, but also the person who starts to see the meaning behind their suffering can open up a door to a greater shift in their life. And the more meaningful that shift, the more that the person is able to claim their healing. The opposite of that is feeling victimized. All this horrible stuff is happening to the person and they're feeling like life is against them and there is no God, there is no hope. Even if they have a faith, they secretly don't believe that it's worth anything, in fact. But if a person can begin to let go of their upsets, go back to the basics of their personal practices that are spiritual in nature, what they will see is that by letting go of the nightmare, they are now open to receiving meaning, purpose, passion, and inspiration to return into their mindset. See, as long as we're upset, we can't be inspired. We can't be creative. If you're worried all the time, you don't feel creative. And the simple version of going back to our spiritual walk is a letting go of the upsets and a reclaiming of our truth as a creative being. Sometimes I call that the point of integration, where a patient starts to see the meaning behind their healing journey and they start to, instead of fighting it, they start to claim it. They start to claim that that's the pathway towards a new chapter of their life, and they become excited about it. This also becomes very important regarding compliance. Let's say that you have a health challenge and there's going to be some dietary changes that are required during the therapeutic phase. Of course, we don't want to stay with restrictions long term if possible, but there are therapeutic phases where until we get somebody better, they have to restrict their diet because we have to get rid of the things that are part of the irritation to the physical body. For example, if you're eating a bunch of bread and it's causing a bunch of bloat and irritation to the gut, well, yeah, we want to treat your gut so that you can eventually maybe handle more of that kind of food. But until we get the gut system better, you got to ditch the bread, as an example. Once somebody sees a spiritual meaning behind their sickness and they are excited about the growth that's coming with it and the healing journey, then if there's a dietary restriction, it's easy because there's meaning behind it. If there's no meaning, then changing a person's diet, when I've had this experience myself, you go to change your diet, if I just had to change my diet to lose some weight, it's not really interesting enough. What are we going to last? A week or two, and then we go back to our old habits. But if there's something more meaningful, which can either be the pain that's pushing us, right? We got into a state where we know we have to heal, we have some autoimmune disaster or something's going on, or the inspiration, or a combo. The inspiration is, this is the life I want. I'm inspired. I can see where my health will lead me. I want to be around for my kids, my grandkids, my loved one, etc. And that bigger picture makes any of the dietary changes just seem like no big deal. So we have to expand our meaning when we have chronic illness. It's for this reason that I take so much time with our patients to teach them about their physiology and how they got sick. That's why the intake is so thorough, because I want them to be part of their journey, versus conventional care so often is disempowering the patient. There's a lot of false concepts and harmful medications, and when the patient asks questions, the doctor talks down to them, and there really is a huge disconnect between what's even being treated, what are the risk factors, and where's the exit plan. It's just not discussed. Sometimes we have reasons for not following a dietary change that's needed. Reasons, right? Reasons are actually something kind of interesting, because we make it make sense, but what is really happening is resistance. We just don't want to do it. That's what's going on. And so I want to introduce the concept of readiness versus willingness. So somebody might be ready to change their diet because they've reached a point where their current diet is harming them, right? So their body is ready, their need for healing, the treatment strategy includes it. So there is a readiness. They're ready to change the diet, right? But if there's no willingness, willingness is that they actually want to do it. They're ready and willing, then you can go forward and great things will happen in the healing journey. But if there's readiness but no willingness, then we have the resistance. The person just doesn't want to do it. And I've been there myself. I once heard a brief clip of an interview with Robert Downey Jr. talking to Oprah. And it was an interesting little clip because she asked him about how he got over doing all these hardcore drugs, really serious drugs that he used to be on, and he was jailed. He was a train wreck. And he said, oh, it was easy. And she looked at him dumbfounded, and she said, you were on some of the worst addictive drugs ever. How are you saying it was easy? And his response was kind of interesting. He said, it was easy to stop doing all those drugs. He said, deciding to. He goes, now that was the hard part. And that speaks towards the willingness. So if we don't have willingness and we're coming up with excuses, I sometimes call that a willingness disorder. Isn't that a great term? We know that we have that in ourselves. We sometimes can see it with family members and friends. It's like, oh, okay, they just don't want to do it. They have a willingness disorder. Ultimately, we can't work harder for someone else more than they are willing to work for themselves. It's a golden rule that you can't break. You can't change that rule. Should you try to change that, you end up codependent. Codependency is you're co-managing their brokenness. It's their lesson plan in life that they need to handle. And if we try to co-manage it, we will lose our sense of self. The telltale sign, if you're starting to get codependent, is that you're thinking of the other person's issues, what needs to change or not change, more than your own. And you also start slowly accumulating resentment because you're spending a lot of energy and they're still not changing. I think we've all been down that road, and the solution to that is to just acknowledge that they have a God and we're not it. We've got to let go. We're not letting go of the reality of the situation. We might be factually right that they need to make changes. However, we can't change people. It's like leading the horse to water. You can't make the horse drink. Hopefully you enjoyed this video. These are concepts that I talk more about in the Herb Academy, where I do cover spiritual concepts, but primarily I'm teaching that functional medicine using herbs, the functions of the plant medicines, the physiology that leads us to understanding how to use the herbs for a given presentation. My post in this modern day war of massive confusion and medical corruption is to teach people traditional medicine. So that's what I plan to do. And if you want to join me, then check out the Herb Academy, and I look forward to seeing you there. All right, bye.